thank you very much. And I'm moving on to our next speaker, who's Raymond Bond, and he is a reader in data analytics at the University of Ulster, where he does work on digital health. And he's going to give a presentation entitled "Who Wants to Talk to a Computer? Chatbots for Mental Health and Wellbeing." Thank you, Raymond.
Okay, hopefully you can all hear me.
Yep.
Who really wants to talk to a computer? We've all heard of chatbots and their potential for mental well-being. I suppose at the outset, I should say what a chatbot is. A chatbot can be through a smart speaker where you talk to Alexa or Google Assistant. I'm sure some of you have these in your home. Or it can be through text messaging, just the way you SMS your friends and so on. You could actually have a conversation with a computer. But who wants to talk to a computer? Well, there is lots of anecdotal evidence. You can see this BBC article, for example, tells a story of a girl that used a chatbot called Vivibot that pulled her out of a really dark place, and you can read that story on the BBC. So she thought that talking to a chatbot was worthwhile, and it did really help. Now you might say, well, I still don't want to talk to a computer. Well, actually, we talk to our pets, and you might say pets are more conscious, more intelligent, and that's why I talk to my pet. I have a relationship, a social bond. But further still, we actually talk to our cars and alarm clocks and inanimate objects. Well, at least maybe I'm admitting that I do. But I'm sure you've all watched the film Castaway, where Tom Hanks develops a really close, intimate relationship with a volleyball that happens to have a human-like face, which is actually a handprint. So we do actually talk to inanimate objects. So why wouldn't we talk to a computer that actually talks back? And there is some research to date that hypothesizes that the more lonely a person is, the more likely they are to talk to inanimate objects. The more lonely you are, the more likely you are to anthropomorphize objects and talk to them. Now, research goes way back, many, many decades, that shows that we actually already treat computers as if they were social agents or sentient beings. And these very early experiments were very simple experiments. A user would get a computer to do a task, and that computer would then ask the user, well, how well do you think I did? And the user would respond, let's say a Likert scale out of 5. But then a different computer would ask the user, how well do you think computer A did? And the user would actually give a different answer. And that's because they were being polite to the computer that was asking them, how well do you think I did? So we do maybe subconsciously already treat computers as social agents. Now, chatbots are more interactive, so we're much more likely to anthropomorphize because we're using our natural conversation, a natural kind of communication with the computer. Now, there's been a whole series of chatbots that have been, designed to support mental well-being, like Wobot and Wiza, and there's, the first virtual therapist was developed many, many decades ago in the 1960s called Eliza. So this technology has been around for a long time, and this is related to Amara's law. Amara's law is the fact that we overestimate the short-term impact of technology, but underestimate the long-term impact. And so many, many decades later, we're now seeing the impact and the promise for more impact for chatbots and mental health. Now, the evidence for chatbots supporting mental health is limited. This is one well-known research study to evaluate Wobot. It's a 2-week RCT, and there is evidence in that paper that show that people who use Wobot have a reduced symptoms of depression. There are many benefits for using mental health chatbots, like they're available 24/7, unlike mental health services that we normally have. We interact with them using text or speech, which is very natural, the same way we interact with humans. And it's anonymous, and we don't feel that we're being judged because we actually are interacting with a computer, and a computer doesn't actually judge us, and we don't have that same type of stigma. Some research and some people believe that people would open up sooner to chatbots because of that fact. And so there are some added benefits to using chatbots. We have a project called ChatPal, As part of this project, we have developed an early prototype of a chatbot, which is available on the Google Play Store. And how we went about designing this prototype, I should say that the chatbot was supposed to be released next year, but we released an early version now because of COVID-19. This is how we went about designing it. We did a survey with mental health professionals to see if they would support the use of chatbots in mental health. We did needs analysis workshops with users who would likely use it. And then we went into a phase of content development, which was quite difficult because I'm a computer scientist. I have to work with psychologists to identify content. Then we went into this collaborative dialogue design. So how do you actually design the dialogue between a computer and a user? And we simply use Google Docs for that. The whole team, very interdisciplinary, psychologists, mental health practitioners, computer scientists, chatbot experts, all got into Google Docs, and we designed a series of conversations. They needed to be converted to flowcharts so that the chatbot could be developed. Then we went into bug logging and all of that to refine the chatbot. The needs analysis workshops were carried out in Scotland, Finland, and Northern Ireland. We will have workshops in other regions as well. The general themes are that people wanted to be able to log their moods, have a conversation around their mood, also to be able to complete scales so that they can get an idea about their symptoms, and so that they can see a time series, a change of their mental health scale scores over time. They would like to be signposted to services, some activities and games, and there was this big push for positive conversations. Nobody wanted to focus on the negative aspects of mental health. It had to be very positive. So we had chosen a positive psychology framework for that. Some important points from the workshops for people living in rural areas. They felt that when during winter and periods of bad weather, the transport is poor and they're not likely to go to attend counselling sessions and so on. So a chatbot would be very useful. It's available 24/7. And people felt that a chatbot would be more anonymous because in a rural area, people know if you're getting a visit. People can work out if you're going to take part in a mental health service, such as counselling and so on. People felt that a chatbot would be discreet. The healthcare professionals felt that they would need to know more about how the chatbot works so that they could recommend it. And again, that's all about trust and building that trust. So we understand that. People did feel that they would open up sooner to a chatbot because they're not being judged, perhaps. People thought it would be good for people who didn't feel that they didn't have the courage to go to a face-to-face session. Maybe a chatbot is a good first initial step. Now, the negatives are that some mental health professionals felt that, can a chatbot really pick up suicidal ideation? And currently, I don't think it can. There's some research on that, machine learning and so on, but we need to be careful. We don't want to rely on computers to do something this sophisticated. And so in our chatbot, we often remind the user that this is a computer, it's not that intelligent, and it's not there to pick up suicide ideation. And we then give them a list of helplines, crisis helplines like the Samaritans, that they might want to get in touch with if they are, if they do have suicidal thoughts. People were concerned about, do I have to repeat myself all the time? So the chatbot should have a memory, just the way humans do. It should remember the last conversation, what you interacted, what you conversed about. And at the workshops, people came up with a certain personality that they prefer the chatbot to have. They prefer it to be young, and mid-30s, female, or gender neutral. But the personality of the bot should be extrovert, empathetic, happy, wise, mature, and so on. All the things that you might expect to see. So, as I said, we have a survey with mental health experts based around, would they prescribe the use of chatbots? And
1 minute, Raymond.
There's overwhelming support that they actually would. They believe that chatbots would reduce travel time. They believe chatbots would help people manage their own mental health. They believe chatbots would be really good for coaching and providing psychoeducation, training, and so on. The experts do believe that chatbots shouldn't be used for diagnosing or screening, which is fine. So we have developed a chatbot to provide psychoeducation. And the chatbot itself is basically converses about PERMA, which you might have heard of. It's a framework to encourage positive emotions in people, to increase engagement, relationships, meaning, and to allow people to be more ambitious and to achieve, as well as monitoring their health. This is some screenshots of the chatbot. There are ethical issues, which I don't have time to go into, but we've thought about these, and there are very interesting papers that show you that smart speakers can deliver harmful advice to people. And the other ethical concern is that whilst people use Google to find about, to get healthcare information, they select what website they look at. Whereas on a chatbot, we kind of legitimize the content that it delivers because it's coming from a humanized conversation as opposed to the freedom of using Google.
Raymond, have you come to an end? Fantastic, because I got a few questions here from people, and the first of that is it about access? Because I think the presentation is very interesting about the acceptability of these interventions, and one of the questions is about how to provide access to people with English as a second language.
Well, certainly on ChatPal, I mean, I can't really answer the question that well, but on ChatPal, our project, we're going to deliver the chatbot in Finnish and Swedish, as well as English.
Okay.
Because the Chatbot project involves Swedish and Finnish partners, as well as NHS Scotland, the Western Isles, and the south of Ireland.
So I suppose there's potential to think about the languages that are spoken across, other languages spoken across the UK. There's another question here from Lorna Hogg, which was about how is risk assessed and responded to using a chatbot?
Yeah, so this was always a big concern for me, so in this first prototype, we haven't done anything super intelligent. We haven't relied heavily on artificial intelligence, because it is about mental well-being, and we didn't want to run the risk of a chatbot or AI delivering inappropriate content or conversations. And we've seen, you can go on the BBC website, there's even some examples of that happening with the mental well-being chatbot before. So for this first prototype, it is very simple. The chatbot simply leads the conversation and directs it, and basically this version just takes the person through some psychoeducation around PERMA, and yes, it coaches people how to maintain a gratitude diary, for example. And to use the WHO well-being scale, right? But the conversation is very limited. It's very one way in this particular version, because if you leave it as an open domain conversation, you do run the risk of giving very inappropriate advice, and that's so we're being very careful. And also, even in this version, we as I said before, we often remind the user that this is a chatbot, this is a computer, it's not a human, it's not very intelligent, and if you do need help, consider contacting a crisis helpline, and we have a website where we list crisis helpline numbers for Finland, Sweden, Scotland, and Northern Ireland. So that's kind of how we're trying to manage it. And actually in the state of California, I believe they have a legislation for developers of chatbots to ensure that they disclose to the user that it is a computer. Okay. Because otherwise you're deceiving people into thinking that, that you're talking to a human, not a computer.
Thank you very much, Raymond.